Well, I lost my daughter Jasmine in 2011 following failures in her care. And since then, my pain has driven a passion really for patient safety, and in particular patient engagement in patient safety, to reduce these tragedies from happening. Well, speaking from my own experience, after Jasmine died, I looked back at what had happened. I looked at the records, I looked at documentation that went between people, and I just saw so many opportunities where if I had been able to see what was going on, if I'd have been able to see the information that was being shared, if I'd have been consulted, if I'd have had some input, then things could have been so different. And also, towards the end of her care, I noticed significant deterioration in Jasmine, and I was raising concerns, but I was on a ward. I was powerless to escalate her care myself, whereas if I'd been at home, obviously I could ring an ambulance or jump in the car and take her to an A&E myself. So I think for patients to be able to see information, have access to good quality information that can help them, help staff keep patients safe, and to be able to escalate their care is paramount if we're serious about keeping patients safe. Well, I do everything that I can realistically while also raising three children and a puppy at home. So I partner on lots of different projects. Recently, I've helped write the patient safety strategy, the patient safety partners section. I'm involved in research looking at the journey of patients before they arrive at hospital, children before they arrive at hospital, and the factors that influence that. I'm just getting involved in new research that's going to look at resources and tools to enable patient engagement in investigations. I speak at conferences like this, and I run a website, Mother's Instinct, to try to raise awareness amongst the public about patient safety issues and to help support people who have been bereaved from medical error. I think that the public need to have more awareness. It's not scaremongering to motivate people to become more active and more involved in their own safety when they're in a hospital. And I think if we could share more stories alongside materials and campaigns to encourage engagement, then we'd probably have more take up in doing so. I think the hub's great. I think the fact that it's free access to everyone is phenomenal. And what I hope to see is more and more patients becoming aware of it and using it in order to increase their knowledge of patient safety and to provide their ideas, because it's often the patient's ideas that stimulate the big breakthroughs in patient safety improvement.